Wanted to just thank again on behalf of myself, Shelley Greenfield, and Scott Roush. Just thanks so much to the leadership of ITP for putting together just an amazing meeting. So thank you, Justin, Laura, and Ipsit. And then along with that, thank you our Ninja RAs, Nick and Sarah, who were so amazing. And again, they'll be accepting applications for many of you for the graduate programs, as well as their Ninja helper team, Patrick, Jasmine, Taylor, Olivia, Alexandra, Catherine, and Luke. So thank you so much to our assistants. Okay, so I was just going to walk through highlights and take-home messages and some fun quotes along the way to maybe help us consolidate these amazing last 2 days. I can't think of a single more important event to be getting underway in the whole of global healthcare, Oliver Harrison. So perhaps, maybe Tom's right, maybe we're at the peak of the hype of, but we'll take some of it. Our field, for God's sakes, needs some optimism right now. As Scott said in starting us off, walking us through the numbers, we're not taking care of those in need, but we're likely in the midst of a revolution. And Laura hoped for a convening moment in the history of mental health, and I personally think we're part of that right now. In the panel 1, Connecting with Technology, Carol Vallone walked us through why data science is so critical, and Justin Baker walked us through both some of the concepts and the sad concepts of where we maybe are in the modern asylum of homelessness and jails, and with Tim Riley's comment of every industry will need to transform itself over the next few years, with some amazing examples that we also saw later of multi-sense visual and face recognition. John Torres walked us through a number of really exciting stories. One of them really bringing home the point of the patient-driven tally counter of his own hallucinations, bringing to point the need for this, and swipe left on the screen for depression. Holly Listenby gave us a terrific keynote really over a whole host of things related to visual learning tools with autism, natural language processing, and where the Brain Initiative is, reminding us of how amazing progress is right now in basic science and how perhaps digital revolution is going to change behavioral science in the same way, with the goal of understanding the brain at the speed of thought, and reminding us that there's tremendous potential for transformation in public health, where we are with morbidity and mortality, as Tom said, is not the race we want to win. In our data blitz, really some terrific brief examples. Laura Tully starting us off from UC Davis, reminding us that there are a lot of great feasibility examples and that there are a lot of evidence that very ill people can still use these even active devices and certainly the passive, but that getting clinicians to complete the surveys may be harder than the patients, and that we have an overburdened system, and that has to be kept in mind for all of these aspects. Courtney gave us a couple more great examples of real-world partial hospitalization programs, as well as how treatment is hard, cognitive treatment is hard, but cognitive bias modification using technology may be particularly powerful. Ian Barnett from Penn, relapse prevention using smartphone apps, the power of passively collective data, and how scalable that is, and importantly that the field is still at the level of feasibility. We now really need to scale up. Menachem Fromer from Verily gave us some beautiful example of the Verily watch and all that it can do right now, and really one of the examples of in mental health where we can watch something develop in the immediate aftermath of PTSD, and how that may be a particularly powerful way to watch with digital technologies it develop over the course of days and months. In panel 2 with digital diagnostics, Alex Widge walked us through the points that diagnosis drives treatment and what would it take for these approaches to naturalistically take over the field and not for us to have to push them on anyone. Armin gave a great talk on the examples of My Coach as a novel approach with automated phone tool, and with his collaborator Sahib Khalsa also talking about some of the apps for using internal and external body images for interoceptive perceptions. And again, so many things that we've previously thought of as really only being in the space of talk therapy with creativity can be used in these ways. Andrea Webb from Draper walked us through some of the multimodal psychophysiology approaches, and LP Morency gave us some particularly entertaining Quebecois stories on verbal, vocal, and visual multisense data collection, and introduced us to the Open Face Toolkit with Ellie, the virtual interviewer, who can be so powerful. in data collection, and how quickly people will open up even to this this bot, if you will. Panel 3, Kerry Goldberg from WBUR walked us through Reinventing the Psychiatric Laboratory. Reminded us why we so desperately need accelerators in psychiatry, and made a great quote from JP. Artificial intelligence is only one pixel away from artificial stupidity. An important reminder. Larger Mind, with her brilliant Test My Brain approaches, gave us a number of examples of the digital lab with 4 billion people who have access to the web, with the goal of how do we characterize many people very well, as opposed to what we traditionally do with characterize few people well or many people in a limited way. Matt Nock, in his really transformational work in suicide, remind us that how we study suicide, for the most part, hasn't changed in 50 years, since the 1960s, but that technology brings us objective markers, real-time assessments, such as IAT approaches and passive devices, but we must mind the gaps, looking for detection, understandable, and scalability. JP, who's been figured well, and we really very much appreciate being at the meeting, and we appreciate being a collaborator, coined the term digital phenotyping and reminded us that is this big data or noisy data, and what do we do with that? On day 2, we began digital tech in practice, applications to geriatric health, and Brent Forrester reminded us that what used to be the aging pyramid is now the aging rectangle, and that it's everywhere, and that 5.4 million will soon have AD costing the U.S. projected to $1 trillion. Ipsit had many great quotes talking about his Emerald wireless signal and other ways of using invisibles in addition to wearables and active devices, stating that if it works in the trenches, it will likely work in controlled settings, and that no one wants a drill, they just want the hole that the drill makes, and so we have to keep that in mind. Jason Hassenstab from WashU was quite entertaining in his former saxophonist career, reminding us of the importance of the 3 R's, rapid, remote, and repeatable smartphone data for cognitive assessments, and had many great points on how this may really transform study of Alzheimer's, but what we may all remember the best is the fire-breathing Rhino Walkbot 2.0 for digital testing. And then Dilip Jeste via Skype reminded us that aging isn't a disease to be cured or prevented. Instead, aging begins at conception and it continues throughout lifetime. And that we have to figure out how to use technology to help with the golden wave to make us, as many of us as possible, be healthy, happy, active, and wise. And particularly rememberable was his figure of opposite curves. As physical health diminishes, for the most part, well-being with aging increases, and how do we utilize that? Shelley Greenfield walked us through panel 5, from action to insight. Ken Duckworth, without slides, from NAMI, reminded us that even with Demi Lovato, no one wants to talk about the music. They want to talk about their mental health. This is pervasive, but how do we reach people where they are? Gary Gottlieb, human health is a right. Our health is a human right, and with the reminder that there are 1,000 psychiatrists in Newton, 40 in Wyoming, and none in Liberia. How do we use telehealth to point the field to where it needs to go, and how do we use the opportunities with these efficiencies, both tremendous and exciting, but we have to take advantage of them. Oliver with Telefonica Alpha Health, the challenge of a moonshot for the problem to address challenge and broken mental health care, bring on the digital cavalry for big data machine learning to help really transform these things, but it's critical that our widgets fit into the value chain. Kim Leary from McLean and Harvard, we're at the inflection point of the ubiquity of cell phones, but reminding us that if we fail to deliver for the majority who is now the who are minority or not people of color, we will fail to at healthcare transformation. Laura's point at the end there. And we must use technology not to just shift the disparities to the digital divide, but instead to mitigate those disparities. Raz Picard is terrific, founder of Empatica and Affectiva, co-founder. Several interesting stories, one of which autism spectrum child has mentioned that everybody is not reading my emotions properly. They're not reading my stress and anxiety, and that we've got to listen to the patients, and that we can use these devices. She gave us examples of really saving lives with technology with the Embrace seizure detector, and how with the ongoing study now, a snapshot with MIT and Brigham, with really the goal of predict risk for suicide and depression, and how then we can start to work towards intervention. Finally, we had a very stimulating and important ethics and privacy discussion, reminding us of the issues of ownership of data, remembering Henrietta Lacks, the importance and not simple issues of tackling healthcare and being aware of it. Chris started with a light reminder of how many ethicists does it take to screw in a light bulb? None until you get your informed consent. Teresa Wynn of Mental Health America, is it wrong to not support people if we can provide them with the tools? And Elisa Bush, we have to engage our patients to bring them along with us as to why research is important, not to tell them that. And Kristen Javaris, I thought this was cute, I don't know where it came from, but the plural of anecdote is not data. And we must be thoughtful about our ethics, and really some fascinating examples with videos and both how that enhances data, but it really raises a whole host of new ethical questions. And then, of course, the illustrious and wonderful Tom Insel that we're so thankful has been in our field for so long and helping guide us along. He felt like the caboose of a very long train, so I don't know what that am. I guess I've got the guy running after the train. The hurt, the hype, the hope. Is there an app for this with our failed mental health system? We can't manage what we can't measure, reminding us that more than half in need aren't getting access to care, and half kill themselves before ever seeing a treatment provider. The hype, though, what we do today isn't working, but smartphones are more ubiquitous than clean water, indoor plumbing, and electricity. And the hope, particularly with the examples of 7 Cups, Alcohol Anonymous, and Facebook combined, and that we must use these basic tenets of value to solve a problem. Efficacy, engagement, and efficiency requires trust, transparency, agency, and responsibility. So I'll end with, I think, some of the most fun quotes of the meeting, I think. Laura reminding us that we have to engage, and the best engagements right now on the web are what kind of cat are you and how many beavers could you take in a fight. So we got some marketing work to do. We discussed fake news from curing depression to dementia with apps with Taurus and Vahia. We talked about Boston drivers, and we now know that despite JP's ignoring stop signs, he's never been caught. And Roz uses Boston drivers to scare MIT students for affect development. Roz also reminded us of the quote that by 2030, depression is forecast to be the #1 disease globally, greater than cancer, accidents, and war and stroke. But Laura reminded us that the people in this room in our field, are our superheroes, the Avengers of mental health, and per Oliver, bring on the digital cavalry. Thanks so much.